Good day, I'm Lorraine Mendez, and this is your JIS News for Tuesday, September 29. Prime Minister Andrew Holness and other world leaders are proposing that more private capital be leveraged to support the COVID-19 recovery process. The statement came out of a high-level United Nations virtual meeting of heads of states and governments on financing for developing countries affected by COVID-19. The meeting was convened between Jamaica and Prime Minister of Canada, Justin Trudeau. Approximately $11 trillion has been spent globally in response to the financial impact of the pandemic. Of that amount, 88% has been disbursed by high-income countries, compared to only 2.5% by emerging and developing economies. The world leaders and officials from international organizations argued that public bodies would need the support of global private entities to ward off the devastating effects of the virus on small and developing nations.
The world needs a global plan as innovative, ambitious, and impactful as the Marshall Plan was to Europe's recovery after the devastation of World War II. We must seize the opportunity this time around to make the global recovery plan sustainable to our climate and environment, empowering and uplifting of the poor, vulnerable and marginalized in our societies, and supportive of democratic and transparent governance.
Prime Minister Holness also asserted that technology access should be a priority area of support for developing countries. He stressed that the increased use of virtual platforms as an alternative to the customary physical engagement in many areas makes it imperative for all countries to have access to digital connectivity.
Also a priority concern is the critical need to ensure that vaccines will be accessible to all countries on an equitable basis.
This morning's high-level meeting had more than 60 international participants. This was the second such meeting convened between Mr. Holness and Prime Minister Trudeau. The first was held in May and another is set for December. 199 million Jamaican dollars will be spent by the government to build 2 additional field hospitals for the treatment of COVID-19 patients. Health Minister Dr. Christopher Tufton and Rogers Land Development Limited signed contracts and broke ground for the projects on Friday. One of the field hospitals will be constructed on the grounds of the Falmouth Public General Hospital in Trelawney and the other at the St. Joseph's Hospital and Medical Center in Kingston.
The facility will be equipped both with the infrastructure, the tools, the equipment, and of course, we're making arrangements to ensure that the personnel are also going to be available to give the support to the COVID response that is so important and so necessary.
Dr. Tufton says government is also looking to procure a mobile hospital from Canada to be placed somewhere in the central region of the country.
We are adding an additional 150 or thereabouts. We could get a little more, but about 150 additional beds for COVID. We already have some 350 in the traditional hospital facilities, and we believe that those numbers, when completed, will give us the buffer that we need to respond to COVID in a way that allows those who need hospital care to get hospital care.
Minister Tufton says these new developments are an indication of the government's commitment to seriously tackle the ongoing pandemic in the country while preparing for any eventualities. Meanwhile, health officials in Kingston took to the streets on the weekend and yesterday distributing approximately 6,000 packages of masks, hand sanitizers and pamphlets. Portfolio Minister Dr. Christopher Tufton, who was joined by community health aides, says the initiative will go across all parishes, with 6 of the 14 being sensitized to date.
It's a standard feature of the work of the community health aides. Behind me in the backdrop here, you see these community health aides. We've hired so far almost 1,000. We are going to hire an additional 300 to 400. They have been trained, and a big part of their job is to go out in communities, in town centers, and be the COVID response representative on the ground to encourage the message, which is so important for everyone to follow, particularly in this time when we're having community transmission.
The health minister is again encouraging everyone to follow the safety protocols of wearing a mask in public, frequent hand washing or sanitizing, and maintaining adequate physical distance from others. He says everyone needs to play their part in responding positively to COVID-19. The latest bulletin posted by the Health Ministry showed 238 new confirmed cases, bringing the country's total to 6,408. Active cases now stand at 4,451. 8 more deaths were also recorded, pushing that total to 101. 12 patients are listed as critically ill, 26 as moderately ill, and 137 are hospitalized. Entities wishing to import alcohol-based hand sanitizers into the country are being reminded that they must have an approved permit from the Standards and Regulation Division of the Ministry of Health and Wellness. The ministry says such entities must have the document in hand before the products are shipped. In a release yesterday, it was revealed that shipments which arrive on the island prior to the approval of a permit are not guaranteed clearance from the ports and risk being seized and destroyed. It also states that the permit issued by the Health Ministry is the only document that authorizes the Customs Department to release a shipment of hand sanitizer to the importer. According to the Ministry of Health, the measure is to ensure the safety, quality, and efficacy of the products being imported for sale and use to the public. Since the global outbreak of the coronavirus last year, alcohol-based hand sanitizers have become one of the standards for sanitizing the hands. The other is hand washing. The Health Ministry says it has taken note of the significant increase in the number of entities importing alcohol-based hand sanitizers without the requisite approval. It's warning that hand sanitizers seen on the market that were not approved by the ministry may be seized. The ministry is advising all prospective importers of hand sanitizers or alcohol for local manufacture to first contact the Standards and Regulation Division, located at 45 to 47 Barbados Avenue in New Kingston. And finally, the Ministry of Justice says the Child Diversion National Training Curriculum has moved to an e-learning platform to continue training more members of the parish committees in light of COVID-19. Child Diversion consultant at the ministry, Ruth Carey, says so far the program has delivered training to the parish committees in Manchester, Clarendon, and St. Elizabeth. She says training started late last year and continued until March, but with COVID-19, the program moved to a virtual platform.
We trained all of our personnel in the program in the national curriculum, and we are now currently developing a training of trainers program module, which we intend to have delivered in October with our staff to ensure that the program is sustained and the education program continues.
The virtual 4-module training of trainers curriculum will focus on child rights and responsibilities, safety and security in treating with children, the Child Diversion Act, and treatment planning. And that's it for JIS News Today. I'm Lorraine Mendez. Thank you for watching.